Thank you so much and welcome. My name is Carolyn Sufrin. I'm an OBGYN and a researcher now based at Johns Hopkins, although I used to live in the Bay Area for 7 years. And I've been working on issues related to reproductive health care for incarcerated women for the last decade. And together with my co-organizer, Lauren Beal, Lauren in the back of the room, and Alicia Walters, I want to welcome everyone here today to discuss the health and human rights of pregnant incarcerated people. And we know some of you have traveled from very far away, have braved the snowstorms, had flights canceled, luggage lost, so we're very grateful that everybody is here. And we're really excited for the conversations and hopefully the action plans that come out of today's convenings. We'd like to take a moment to thank AJFO for allowing us to organize today's event in advance of the AJFO conference happening over the next 3 days that we hope to see many of you at. So we know that on any given day, there are nearly 219,000 women who are behind bars in the United States. We know that this number has been growing over the last 4 decades as a result of many intersecting social, political, and economic forces. We know that mass incarceration has disproportionately affected women of color and their families, and that the reasons that these women are trapped in the criminal legal system has less to do with crime and more to do with structural and racial inequalities in housing, employment, mental health care and addiction treatment, policing, trauma histories, and other non-criminal factors. We also know that 75% of these women are younger than 45 years old, so they're of childbearing age. And we know that nearly 2/3 of them are already mothers and the primary caregivers to young children. The majority of these women have been sexually active with men in the months prior to their arrest and prior to their incarceration, and most of them are not using a method of contraception before they come into custody. And thus, some of these women will enter jail or prison pregnant. But we actually have no idea how many of women that is, and we have no idea what the outcomes of those pregnancies are. This absence of data is reflective of the broader neglect of women's gender-specific health care and family needs in the criminal legal system. We do also know that the impact of incarcerating pregnant people and mothers has a ripple effect for them, their children, their families and communities, and society at large. We are all here today because we care about those ripple effects and know that we can do better. Today is about centering the needs and experiences of the pregnant incarcerated people and to devise strategies to remedy their neglect. Being pregnant in prison or jail is an unusual experience, to say the least, for the pregnant person. Now, I'm going to defer to our upcoming keynote speakers and other previously incarcerated people who are here in the audience today to discuss this in detail, since they, not I, are the experts in this. For those who are on the custody and administrative side, having a pregnant person at your institution presents a range of issues that must be addressed, including ensuring a safe environment for the pregnant person where her medical, mental health, and social needs can be tended to. The medical team also must ensure that the pregnant person receives quality pregnancy care, comprehensive care that is in line with national guidelines and community standards, and custody and medical must work together to ensure that pregnant people receive adequate nutrition, appropriate housing, appropriate triaging of symptoms, a safe birth experience, postpartum care, including access to breastfeeding when desired, and opportunities to bond with their newborns. But pregnancy in institutions of incarceration not only raises issues for the incarcerated person, custody, and medical staff, but it also raises unique human rights and reproductive justice concerns. We will discuss many of these today directly, such as the shackling of pregnant people in custody, and others of these human rights concerns form the overall backdrop of our conversation today, such as the harm that mass incarceration continues to cause, which disproportionately affects poor communities and communities of color. As many people, including some of you who are in this room, have pointed out, mass incarceration disrupts women's rights to have children, to not have children, and to raise their children in safety and with dignity. So we are here today to talk about the experiences and needs of pregnant incarcerated people and to devise action plans to promote their well-being through policy and legislative strategies, programs, promoting standards of care, and developing research, among others. The key organizing principles of today are to center the voices of pregnant incarcerated people, to engage people from very different backgrounds to develop action plans to address their health and human rights, to share preliminary data from the PIP study, which you'll hear more about, and to brainstorm how these data can be used strategically towards these ends, to reflect on doula and breastfeeding support programs inside prisons and jails, and we hope to build a network of collaboration, a network for future collaborations. Now, many of you in this room are already working tirelessly on these efforts, whether raising awareness through sharing your own experiences of being pregnant and incarcerated, whether providing care and services to pregnant incarcerated people, or advocating for criminal legal system reform, or all three of these. And today's gathering, we hope, will harness these commitments and the creativity that people have brought to this area through conversations and collaborations among people with different backgrounds. Now, when you registered, some of you shared your personal reasons for coming to this event. And I have just a sample, not everybody's responses, but just a sample of some of these below. Looking for resources to improve care in our jail. Mass incarceration is destroying the Black community in the US. It needs to be dismantled. I'm excited to learn more about the data and to make new connections. Would like to learn more about the challenges and barriers facing pregnant incarcerated women and mothers and the solutions or remedies to those problems. Healthcare in jail and prison is fragmented and broken, and I want to help change the care provided to pregnant people. I believe that collaborative work with formerly incarcerated people, their friends and family, and professionals working in that setting offers the best opportunity for designing more just systems. So you can see that people are here to learn, to connect, and to intervene. Now, while we may all come from different backgrounds, we all share a concern for the health and well-being of incarcerated people. While today's event is certainly not the first one to address the needs of pregnant incarcerated people, one thing that is unique about this gathering is that it brings people together from diverse experiences and professional backgrounds. And so there are people here today who have been incarcerated and pregnant themselves, who work inside prisons and jails, who work at community organizations to provide services to pregnant incarcerated people, people who advocate for dismantling mass incarceration, healthcare professionals, researchers, and others. And many of those categories are overlapping. Having people with different backgrounds in the same room can, we hope, lead to productive conversations. But we also want to acknowledge up front that it may be challenging for some people to be in the same room as others. And we hope that everyone will be sensitive to the fact that we all have different professional backgrounds and personal experiences, and that we'll all engage in productive and respectful conversations. Now, who is not here today? We talked about who is here. Of course, currently incarcerated people cannot be here today. Now, we are video recording today's event, and we welcome your ideas on how we can share this with them, but that is one of the reasons that we are filming today's event, so that there can be a record and it can be shared with people who are not here today. Other people who are not in the room are people who are not interested in the well-being, dignity, and human rights of incarcerated people. And that's to say that everyone here shares this broader concern. And then other people who are not in the room are the broader public that still need to be informed and still need us to guide them on how incarcerated people are treated at the moment and how they should be treated. I do want to flag for a moment that in our conversations today and beyond about pregnant incarcerated people, we should all be thoughtful about the language that we use. The words that we use to talk about people can convey many things, from respect to degradation. Now, some people commonly use terms like inmate or offender to refer to a person who is incarcerated, and usually they do so without intending to cause harm or to, well, offend. But for people who experience incarceration, these terms can be stigmatizing and can feel pejorative. And so instead, referring to them as an incarcerated pregnant person acknowledges that incarceration is an adjective. It describes where they are right now, but it doesn't define them. And the gender-neutral term that I've been using and that many of you use, person, also acknowledges that some pregnant people may not identify as women. For some, even the phrase correctional facility, and we acknowledge that we have correctional in the title of this event, but it can also be problematic for its neutral sounding tone. And instead, people favor calling these institutions what they are: prisons, jails, detention facilities. So we ask that you be cognizant of your language, because at the end of the day, it's all about just recognizing that no matter where they are, their circumstances, or what's happening in their lives or with their bodies, we are all people first. So here's an overview, which you have in your program, of what's going to happen today. The schedule, I know we started a little bit late, so everything is adjusted a few minutes. But just to give you a brief summary, we'll first, after I'm done with my remarks, we'll hear from some keynote speakers, and I'll introduce them in a moment. We're then going to have a data session that we'll tell you more about, but that's where we're going to tell you about the study that we've been doing to collect pregnancy outcomes data. And this is really a brainstorming session for all the people in the audience to come together and discuss data. Then there'll be a lunch break, and we hope that you all will talk to each other, get to know people that you haven't met before. And then at 1, as people are finishing up their lunch or still eating, we're going to hear an exciting update on a recent convening that was held about nationalizing laws against shackling in pregnancy. We're going to have a panel about doula and breastfeeding support programs. And then towards the end of the day, we're going to have breakout sessions, and this is where most of the work is going to happen. We're sort of giving information, and these sessions are going to be interactive too, but really a lot of the issues that come up in the earlier presentations, we're going to have time to talk in much more detail and to strategize and hopefully come up with action plans and next steps for collaborations. And then we'll close with some closing remarks. And then again, I encourage you, if you are on Twitter, please live tweet with our hashtag, which is incarcerated and pregnant. Finally, I want to thank some people and express our gratitude to the advisory committee, and the names are listed in your program. Alicia Walters for her wisdom in helping us or craft the content, goals, and activities of the convening. And of course, to our sponsors who have generously made it possible for us to bring together everybody in this space. So with that, I would like to now introduce our 2 keynote speakers. And both of our keynote speakers are people who have been incarcerated and pregnant, and they are going to share their experiences with us today. And we are very fortunate that they are sharing their stories because that is what we need to hear. These are the experiences we need to hear. This is what makes change possible, what identifies what the problems are. And these women are the experts in what needs to happen and what needs to change. So our first keynote speaker is Kayla Moye. Kayla is an abortion storyteller with We Testify, which is based in Cleveland, Ohio. She participated in Patients to Advocates, a leadership program of Preterm, a Cleveland abortion clinic. And Kayla has shared her story of being a mother who had an abortion and speaks out about pregnancy healthcare access and abortion access for incarcerated women. And we are just thrilled that she's here with us today. Our second keynote speaker is Miyoshi Benton. She is the associate at the Women in Justice Project, a nonprofit organization that's dedicated to centering the leadership of women directly impacted by incarceration in its work to end mass incarceration and criminalization in the U.S. Miyoshi was a leader of the successful campaign to pass the 2015 New York State anti-shackling law that bans shackling of incarcerated pregnant women in the state, and it's one of the most progressive laws in the nation. Miyoshi is a recipient of the 2015 Susan B. Anthony Award from the National Organization for Women, the New York City affiliate, and the 2016 Our Children Mother of the Year Award. So I would like to thank you all and welcome our speakers, and we'll first hear from Kayla. Thank you very much.